Ladies and gentlemen, welcome to the program, Women's Series Summer Skin Check. For this webinar, attendees will be in listen-only mode. If you need technical assistance, please submit your request under the Tech tab in the window in the top right-hand corner of your computer screen. If you wish to submit a question during the presentation, please use the Q&A window in the top right-hand corner of your computer screen. Presenters will do their best to answer your questions. However, due to time constraints, not all questions may be addressed during this webinar.
Welcome everyone, and thank you for joining in on our wonderful Easy webinar series. My name is Rebecca Mason, and I'm the program manager for our well-being programs Live Easy, and I'm today's host for our fabulous webinar. I would like to thank our sponsors of our 2021 Easy webinar series, AccuRisk Solutions and Nationwide. From medical dermatology to aesthetics, there is no shortage of topics to talk about with your dermatologist. The skin is the largest organ in the body, so the importance of keeping your skin healthy cannot be stressed enough. With skin cancer affecting 1 out of every 5 Americans, it is so important to emphasize the importance of skin checks and wearing your sunscreen. I am so excited to have Dr. Cresswell joining us today to give us all the tips on keeping our skin healthy and beautiful. He's been voted a top doctor in Minneapolis-St. Paul, is a board-certified dermatologist at Dermatology Specialist, which is one of our preferred providers with America's PPO and our Elite Network, and he is also a member of our Clinic Advisory Board. I would now like to turn it over to the incredible Dr. Cresswell to talk about the latest advancements in dermatology and summer skin checks.
Great, thanks Rebecca. Thanks for that introduction. I'm really excited to be here today. Like Rebecca said, I work in Edina, Minnesota, which is a southwest suburb of Minneapolis. I work at a group called Dermatology Specialist. I'm an owner there. I'm one of 15 dermatologists. And I'm excited to talk to you guys today. What I wanted to go over is I kind of thought about what are the types of things that I get approached by people at parties, by friends, to kind of go over the stuff. Hopefully it can be fun and informative. The things that I want to try and cover today are a few things. The most important thing I want to go over is when do I need to be worried about something on my skin? When do I need to schedule an appointment with a dermatologist? What are the types of things that should be concerning? As Rebecca said, 1 out of 5 people will have skin cancer in their life. So this is what we want people knowing. Hey, what are some of those worrisome signs that need to have you come in and get checked? A huge thing that I get to ask about is what are the best type of sunscreens? What are the best type of over-the-counter products to use? So I hopefully have some really informative slides on those. I'm going to show you some name brands that I like because I feel like that's something that's hard to find is what are things that people like. And hopefully what you'll get from that is a realization that you don't need to spend a lot of money on that type of stuff. The skincare industry is a multi-billion-dollar industry, but a lot of the stuff that's out there really is not that beneficial. So hopefully I can talk to you about where it makes sense to spend a little bit more and where you don't need to. I want to go through kind of what's a good topical regimen to use to keep your skin looking younger. What are the steps you can do to keep your skin looking younger? And then finally, I want to go over a little bit of some of the aesthetic treatments that are available in a dermatologist's office. Some of the ones that I think are really worth their bang for the buck and go over how those work. So first thing I want to talk about is when do I need to worry about a spot on my skin? And before we even get into the details, my answer always is if there's something you're worried about, come in and see me. I'm always happy to see you. I always tell my patients, I'm never going to get upset at you for coming in and saying I'm worried about this and me going, oh, it's clearly a benign spot. That happens a lot. There are lots of growths that we get on our skin. You can't see your heart. You can't see your liver. So you don't know if you're getting a little spot on there. Your skin is very visible. And so if you have anything you're at all worried about, I would ask your regular doctor or come see a dermatologist. We're always happy to see you. Those are some of my favorite visits when you come in and say, what is this? I'm really worried. And I can tell you, hey, that's not anything to be worried about at all. And I can educate you on what it is. So never hesitate to come in if you're worried about something. What I want to try and tell you are things to look for, things that you might not know to be worried about, that could be things that could be worrisome. The deal with skin cancer is the quicker we catch it, the easier it is to treat. The smaller a scar is going to be if we have to do surgery, the less likely any skin cancer is going to be to spread internally. So time is always of the essence in trying to catch things. A lot of you may be familiar with this monogram for things to look for in moles. So one of the things we're always looking for is a mole that's changing or a mole that's darker. This could be a melanoma, and melanoma is the most serious type of skin cancer that we see commonly. It's a type of skin cancer that if we don't catch early, can spread internally and can cause really bad things. It's also often not very symptomatic. So this is something that may be small and may not look like much, but if we catch it early, we can treat it much more easily. So this is something that the American Academy of Dermatology came up with about 30 years ago. It's the ABCDs, and then they've added an E for things to look for in your moles. So let's walk through this a little bit. You can see on the left of your screen are normal moles. On the right of your screen are cancerous moles, to try and provide a contrast between something that's normal and something that's not. So one of the things that we are always having you look for is if a mole is asymmetric. That's the A in the ABCDs. So the way to look for that is to basically take a line and divide the mole in half. If one side looks a lot like the other, that's a good reassuring sign. You can see that cancerous mole that's in the top right corner. The right half of the mole doesn't look at all like the left half of the mole. The left half of the mole has this dark protruding area. The right half is flat and has some of these irregular borders. So that's a concerning sign. B is for borders. So a smooth kind of rounded border, that's a reassuring sign. If there's an uneven, or what we like to call a scalloped border, which you can see on that second photo down on the right side, that's concerning. That's something that we want to take a look at. C is for color. So healthy moles tend to be uniform in color, and they tend to be different shades of brown or even kind of pinkish brown. If you're seeing multiple shades of colors, especially reds, whites, blues, blacks, those are things that are not normal in moles, could be problematic. That's something that we want to take a look at. D is for diameter. So normally a melanoma is going to be larger than the size of a pencil eraser. So the bigger a mole is, if it's fitting some of those other criteria, that's something that's also concerning. This one, I always give the caveat that everything has to start small. So it's definitely possible, and I see these, to see a melanoma that's smaller than a pencil eraser. So if you've got something that's concerning, don't let that dissuade you from coming in. The E that they added is for evolving. So if you see a mole that's changing, if you look at a mole and you say, I know I've seen that mole, I may not remember exactly what it looks like, but it looks different now, that's something to be concerned about. So all of these are things where it makes sense, if you see one of these, to check with your primary doctor or to schedule an appointment with a dermatologist to be seen. I often talk to my patients, I talk about this, but the other thing that I often talk about is an ugly duckling mole, okay? Because I find that especially for people who have a lot of moles, it can be really difficult to go through and try and apply all of those criteria to each of your moles. I don't expect you to be a dermatologist. I expect you to go about your life. What I tell people is, if you see a mole that really looks very different than your other moles, especially if it's dark, that's something that we want to look at. If you look at a mole and you say, hey, it doesn't fit some of those criteria, but I have 20 other things that look a lot like it, that's a really reassuring sign. People don't grow 20 melanomas at once. If you look at a spot and it doesn't fit some of those A, B, C, D, E criteria, but it looks very different than your other spots, that's much more concerning. That's something that we want to see. Certainly, there are things that are ugly ducklings, growths that look like that don't look like your other spots, that are benign. But again, it's hard to train you how to be a dermatologist and know the difference between all of those. So if you're seeing something that looks really different than your other spots, that's something that we want to see. The other thing that I often tell people to look for is something that's like a sore that doesn't heal. So this is the common way that non-melanoma skin cancers present. So the melanoma skin cancer, you want to be looking for something that's really dark or different than your other moles. But a sore that doesn't heal, these are actually much more common. Basal cell carcinoma and squamous cell carcinoma are the two most common types of skin cancer that we see. And these tend to present as a sore that doesn't heal. Sometimes people will describe these and say, I have a pimple, but it's just not going away. Or I have an area that when I shave or when I wash my face, it bleeds and it keeps bleeding. A sore that's not healing, that's concerning. Certainly, you're allowed to get a pimple that comes and goes. And sometimes they can bleed for a little bit. But what I tell people is, if something's not going away in a few weeks, that's probably not a pimple. That's something that we want to take a look at. Squamous cell carcinoma and basal cell carcinoma are usually treated surgically, so we usually cut these out. And you can imagine, if you look at the gentleman on the left who has that large plaque on his cheek, that spot has probably been there for 5 years, and it may have started more like the smaller spot that's in the top left corner. It's a much easier surgery to do the smaller something is. So this is something where if you have a sore that doesn't heal, again, we want to see that so we can take a look at it. So probably the most common question that I get is, what are the best sunscreens to use? And my short answer for that is the best sunscreen for you to use is whatever sunscreen you will actually use. So there are, one of my least favorite things to look for sunscreens was there was a Consumer Reports article that came out saying the best sunscreens. And all that they looked at was the price of the sunscreen and how well the SPF held up to what it said. But the sunscreens that they said were the best were incredibly sticky and tacky, and very cosmetically inelegant. And I know from patient experience, no one's actually going to use those sunscreens the way that they're designed. So I want to try and help you find something that you actually feel comfortable using, because a lot of sunscreens can be uncomfortable for different reasons. So I want to try and help you find something that will work for you. In general, the things that I would have you look for is, if you're using this as a sunscreen that you're using when you're really going to be out for a long time, we want to have an SPF of at least 30. The SPF tells you what factor of protection you have from getting a sunburn. So the idea is an SPF 30 sunscreen, if it's applied appropriately, you can be out in the sun for 30 minutes and you'll get the same amount of sun absorbed in your skin that you would had you been out for 1 minute if you were not wearing that SPF. Okay. The other words that are important to look for is broad spectrum. Broad spectrum means it doesn't just prevent against UVB, which is what causes sunburns, but it also prevents against UVA absorption. And UVA is what can lead to wrinkles and aging skin, and also we think plays a role in the development of melanoma. There are lots of great waterproof sunscreens that are out there. And if you're going to be in the water or you're going to be sweating profusely, I would suggest finding one that's waterproof. In general, the sunscreens that are waterproof are going to feel stickier and tackier on your skin. They have to have some sort of ingredient that goes and forms kind of a polymer on your skin. So if you're not going to be out in an area where you're going to be wet or you're going to be sweating a lot, you may want to find a sunscreen that's not waterproof, because it may feel a little bit more what we call cosmetically elegant. The vehicle that the sunscreen comes in is really whatever you prefer. I don't have a strong opinion on creams versus lotions versus sprays versus sticks. I personally use a lot of creams on my face and my arms and my legs. I have a spray that I use if I'm going to get my chest and my back. Really, it's whatever you feel comfortable using and whatever you're actually going to use or whatever you're going to get your kids to use. There are lots of different ingredients that go into sunscreens. We classify them into 2 different types. There are chemical sunscreens. Chemical sunscreen is a chemical that sits on top of your skin, and when ultraviolet light comes in, it absorbs that ultraviolet light, it changes the shape of the chemical, and the ultraviolet light doesn't go back into your skin. Physical sunscreens form a block on your skin. If you think about to lifeguards 50 years ago, and even you'll see them some now, who had white noses, that's a physical sunscreen. That was pure zinc oxide. It's basically putting white paint on your skin. It works very, very well, but obviously it's not very cosmetically elegant to be painted all over white. What we have now are we have nanoparticles. So they've taken that zinc oxide and titanium dioxide, and they've made it very, very, very small. So it can go on your skin and it doesn't look white, but it still gives that same physical protection. So the chemical sunscreens work very well to protect against sunburns. This is the one where there's some recent articles calling into question some safety concerns, and really the jury is still out on these, but I want to talk to you about this. What we know is that chemical sunscreens, if applied every day all over your body, do get absorbed some into your bloodstream. It's a small amount, but those chemicals are in your bloodstream. There's no good studies as to what that means. So no one's done enough studies to know, is that harmful to have those chemicals in your blood? But of course, there's some concern that these are chemicals that we're not used to having in our blood. Some chemical sunscreens can bleach coral reefs. So Hawaii and other places have outlawed some of the chemical sunscreens because they don't want the coral reefs bleaching. And then recently, there was a study that was done that came out and found benzene, trace amounts of benzene, which is a cancer-causing component that were found in some chemical sunscreens. For these reasons, out of an abundance of caution, what I usually recommend to my patients is to use just physical sunscreens for something that you're going to use every day and on kids. If you are on a trip in Mexico and you know you're going to be out on a boat all day long, I really don't think there's any concern in using some chemical sunscreens if you've got one that you say, hey, this is my favorite waterproof one. I want to use this on an occasion because it really helps keeping me from getting sunburn. But I wouldn't use that daily because of some of the unknown risks of the top points here on this slide. So let's go into some actual products that I like. So I divide sunscreens into what I call my daily sunscreens. And then here in Minnesota, we call them cabin sunscreens because that's what we do in Minnesota in the summer is we go to cabins and you swim and you're out on the lake all day. And so you need a different caliber of sunscreen for something where you're going to be out all day. You want something that's stronger. You want something that's very waterproof. That's not something you're going to want to wear every day if you're going out to lunch with friends, if you're going to and from work. So the daily sunscreens that I like, a couple really good over-the-counter ones are the ones on the far left and on the far right. I really like the Oil of Olay. They're only SPF 15, but it really goes on well. If you can't find something that's stronger than that you like every day, certainly putting that SPF 15 on as a good daily sunscreen is much better than doing nothing. CeraVe AM is a very nice product as well. The two products in the middle come from a brand called Elta MD, which is a physician-grade product. So you can find this in a dermatologist office, or there are online places that you can find these. These are really nicely formulated. Both of these ones just have physical sunscreens. The difference between them is the one you can see that has a little brown squiggly part by it is a tinted sunscreen. So people who tend to like that are women who tend to wear foundation or people who have a darker skin tone at baseline because it goes on kind of like a very thin foundation. It gives a little brown tint to the skin. The 46 Clear, which is kind of the cylindrical pump, that one doesn't have a tint to it. So these are some options for good daily sunscreens. Here are what I like to call my patients cabin sunscreens. These would be what you'd wear if you're going to the beach or the pool, or you're going to be out all day, you're hiking in the mountains, something where you say, hey, I'm going to get a lot of sun exposure. These ones here only have physical sunscreens in them. And they're waterproof because all of these things are areas where you're going to be wet or you're going to be sweating a lot. The two ones that you can get over the counter are the Vanicream. Vanicream is made at the Mayo Clinic, or Blue Lizard. And then I have a different Elta product here. I wish that this came in a gallon pump for me to keep at my cabin. This is what I put on myself, on my kids every day we're up there. These are going to be a little bit whiter and tackier than the daily sunscreens, but they're going to give you really good protection. One thing that I didn't mention about chemical sunscreens, if they get into your eye, for some people can burn and kind of give this stinging sensation. And so I have a lot of people who come in and say, I can't tolerate using sunscreens on my face because they get in my eye and they burn. Physical sunscreens will not do that. So that's another reason to consider using these types of sunscreens to keep them from irritating when they get in the eye. So that's kind of talking about sunscreens, and that leads into what can I do to help keep my skin looking younger. As I said, this is a billion-dollar industry, okay, multi-billion-dollar, and there's a lot of stuff that's out there that really doesn't do anything. The thing to remember is for an over-the-counter product to be approved by the FDA, it doesn't have to show that it's effective in doing anything. All that it has to prove is that it's safe. So anything that makes any claims on its product has not necessarily been validated by any studies. And there's a lot of stuff that's out there that's purported to do a whole lot that we really don't think does anything. The most important thing that you can do to keep your skin looking younger is to use a daily facial sunscreen. The earlier you start with this, the less sun you get, the better. There's a reason that the backs of our hands and our forearms and our face and the V of the chest in women is where we see the most wrinkles, the most dark spots. All of this comes from sun. Age plays much less of a role than the cumulative amount of sun that you get. There were great twin studies that were done comparing one twin who was a sun lover versus one who was not, and the difference between the aging in their skin is impressive. So using a daily sunscreen, like we talked about before, that is by far and away the most important thing you can do to keep your skin looking younger. The next most important thing is to use a nightly retinoid, which is a vitamin A type of cream. These used to be prescription, but now we have over-the-counter options. These medicines really tend to help with fine lines and wrinkles and help keep to preventing dark spots. And we'll talk a little bit more about that. It's probably a good idea to use a mild cleanser every day. And you can use a moisturizing cream if your skin feels dry. These are not as important as, especially the moisturizing cream is not as important as the industry would make you think. There are some people who have more oily complexions that don't need a moisturizing cream every day. Moisturizing is probably not going to help your skin look that much younger. It's only going to help if your skin is feeling dry. Serums are a hundreds of $million category of products that are out there. In general, they may help a little bit. There are some that I prefer a little bit more than others. These tend to be expensive. What I tell people is you're probably going to get about 90% of the benefit from using a daily facial sunscreen and a nightly retinoid. The serums could maybe play a little bit of a role if you're already doing those, but they're much less important. Toners is kind of a category that was created by the cosmetic industry. Toners are alcohol-based products or something like that that are designed to take oil away from the skin. There's really no need to use a toner. If you like the way that it makes you feel, that's okay. There's probably nothing wrong with it as long as your skin is not feeling dry, but it's really kind of an unnecessary category, and it's something that these tend to be pretty expensive. Facials that you would get at a spa, I always tell patients facials are for fun. So if they make you feel good, if you like the way your skin looks afterwards for a few days, that's fine. But doing a facial is not going to alter anything kind of intrinsic to your skin that's going to help things look better over the long run. So let's walk through each of these categories a little bit. The daily facial sunscreen, we already covered this. These are some of the daily facial sunscreens that I like. And remember, this is the most important thing you can do to help keep your skin looking younger. Even if you already have a lot of sun damage now, it's important to start now because it's all cumulative. Yes, it would be better if we could put you in a time machine and you go back 30 years and you can start using a daily facial sunscreen. But even if you have it now, there's still damage that's being done. The nightly retinoids, so most people have heard of Retin-A, okay? And Retin-A was the original prescription product. The generic of that is tretinoin. These are a nighttime cream that goes on, and over time they can help with fine lines and wrinkles. The prescription versions of them tend to be kind of expensive. What we have now is we have an over-the-counter version that's called Differin. And Differin, even though it's over-the-counter, it is as strong as the Retin-A or tretinoin that is prescription. Differin is marketed as an anti-acne medicine, and it does work. It helps prevent blackheads in teenage acne. So if you look at it, it's not going to talk about its anti-aging properties, but it's a very, very good retinoid, and it's what I recommend most of my patients use for a nightly retinoid to help prevent sun damage. It's not real expensive. I think the cost ends up being about $15 a month to do Differin every night. And remember, that is by far and away stronger than any expensive serum, toner, facial that you can get. This is the best bang for your buck. Moisturizers. I live in Minnesota. It's cold and it's dry. We see a lot of dry skin. I love good moisturizing creams. Here is one where more money does not mean better. You know, there's this La Mer cream that's $400 for a small tube. It's been put on head-to-head studies with this cream on the left here, CeraVe cream, and CeraVe outperforms it every time. So a moisturizer is not something that you need to spend a lot of money on. I tend to like ones that don't have a lot of fragrances in them, plant products and fragrances. They can smell really nice, but they can be irritating to your skin, and we don't have a lot of data as to what putting those on your skin does every day in terms of absorption. So these are my two favorite creams, CeraVe moisturizing cream and Vanicream. For most people, don't need a different moisturizer for your face or your body. Again, facial moisturizer as opposed to a body moisturizer. These are just categories created by cosmetic companies to help sell more products. But I'll tell you, in my family, we go through probably 2 of these pound jars of CeraVe cream every month, and it goes all over face and body, more in the winter than in the summer. So when things are feeling dry, that's when we do things. I like mild cleansers. Again, we tend to like unscented products or fragrance-free products. Cetaphil Gentle Skin Cleanser is a nice cleanser. These are great to remove makeup, to remove excess dirt. Washing your face is probably a little bit less important than the industry makes it out to be. I tell some of my patients all you need to do is stick your face under the shower. But if you want to use a mild cleanser or if you have makeup to remove, I like Cetaphil or CeraVe Gentle Cleansers. These are not super helpful if you have acne-prone skin, and we'll talk about that in a little bit, some of the products that we use for people who get acne. So this example skincare regimen, this is my skincare regimen. This is my wife's skincare regimen. So Cetaphil Gentle Cleanser in the shower in the morning. Then we put on a daily sunscreen. We use Elta 46. At night, we put on a little bit of Differin gel, which is that prescription retinoid, and then we'll put on a thick layer of CeraVe cream. During the winter, I tend to use CeraVe cream more than once per day. I tend to put it on twice per day. I put it on after my shower in the morning, and I put it on at night. This is not to say that this is the regimen that's going to work absolutely best for everyone, but I want to show you this is what the dermatologist and his wife are using. None of these are very expensive. You don't need to spend a lot of money to get a good quality regimen. I told you I'd talk to you about teenage acne. So I want to differentiate. A lot of adult acne is different and probably needs a dermatologist to assess it, because if you're getting adult acne, it probably is not going to respond real well to the over-the-counter products that are out there. The types of acne that I do respond well are teenage acne, so acne that teenagers get, and then body acne. So by body acne, I mean if you're getting pimples on your chest and on your back, but not too much on your face. Then benzoyl peroxide is the over-the-counter ingredient that tends to work very well. If you go and you look at the acne aisle, most acne washes will have salicylic acid. Salicylic acid really is not that effective for treating most types of acne. Benzoyl peroxide is the ingredient that you want to look for. The reason that a lot of products have salicylic acid is that benzoyl peroxide, you have to know how to use it, because if you leave it on your skin, it can be very drying. And if you don't rinse it off completely, it can cause bleaching of towels and clothes. So this is a specific brand that I really like called Panoxyl 4%. That's the benzoyl peroxide wash that I like the best for teenage acne and body acne. And what I tell my patients is you only use this in the shower and you rinse it off completely. Rinse for twice as long as you think that you need to. It only needs to be on there for a little bit. You don't want to leave any residue on. That's what's going to dry you out. That's what's going to bleach your towels. Please don't use washcloths or loofahs. There's no need to scrub and exfoliate. Exfoliating is a kind of another myth that the cosmetic industry has created. And washcloths and loofahs just tend to be reservoirs for bacteria and spread bacteria and continue to make acne worse. I wanted to touch really quickly when we're talking about over-the-counter products on wound healing, because there's a lot of misconceptions on wound healing. The theme of my talk here is you don't need to spend a lot of money. So there's a lot of expensive things that are out there that they say are going to help your wounds heal faster, and they don't. In most cases, they're actually just harmful. Most wounds, even surgical wounds that I have, big open wounds, all that they need is they need to be covered by something that keeps it moist, and we like Vaseline, petroleum jelly, or Aquaphor, and then cover them up with a Band-Aid or a bandage. These three things are all that you need. After things have healed up, if you have a scar that you want to make look better, there's one thing and one thing only that's been shown to help, and it's not Mederma. Silicone gel sheeting or creams are the one things that have been shown to help. The one brand that we found that we like the best at our office is called Scar FX. This is something that you use and you put on after the wound has healed up. So while something's healing, all you need is Vaseline and a Band-Aid. You do not need Neosporin or bacitracin on your wounds. I repeat, please do not use Neosporin. Please do not use triple antibiotic. Please do not use bacitracin. They've never been shown to help a wound heal faster. There have been lots of head-to-head studies, and the only reason that they help a wound heal faster is the Vaseline that they're in. So if you compare them to doing nothing, the wound will heal faster. But if you compare Neosporin to Vaseline, they heal at the exact same rate. The antibiotic in there does nothing to help your wound heal any faster. In addition, about 10% of the population develops an allergic reaction to these products if you keep using them over time. So it's a very common issue for patients to come in to see me, and they have a cut that they've gotten, and they think it's infected because it's red and it's itchy around them. But in fact, what's happening is they've developed an allergic reaction to Neosporin or bacitracin. And when you develop an allergic reaction to it, then it's like you're putting poison ivy on your wound. So in my opinion, if they ask me, I would have these completely pulled off the market. I don't know of any good use for Neosporin or bacitracin. It's a waste of your money. It doesn't help wounds heal faster, and it's likely to cause adverse reactions. So remember, all you need, Vaseline and Aquaphor, cover it up with a Band-Aid. You want to keep things moist. You don't want that scar to dry out. You don't want it to get crusty. You want to keep it moist. All right, so we talked a little bit about the over-the-counter products that are out there. I want to talk about some of the in-office treatments that are available. Again, big industry. There's lots and lots of lasers and devices that are out. I'm going to talk to you about my favorite things that give the best bang for the buck. So here, especially in Minnesota, my consumers who want to spend money in the office, they want to know that they're going to get bang for their buck. They're not necessarily looking for the newest, latest technology that might help a little bit. I'll tell you, I have these laser reps who come to the office and they show me the before and after pictures. I'm a trained dermatologist. Sometimes I have a hard time seeing the difference. So a lot of the new cutting edge stuff is maybe not really all that much bang for your buck. I'm going to talk to you about some of the treatments that we offer in our office that I think have the most bang for the buck. So Botox, most people have heard about. Botox works really well for wrinkles that are on the upper part of your face. We call these dynamic wrinkles. They're called dynamic wrinkles because they come from your muscles moving. So frowning, raising your eyebrows, smiling, these all cause these wrinkles to occur. Botox is not a wrinkle eraser, it is a muscle paralyzer. We inject it into muscles and it makes it so that when you try to make those expressions, when you try to raise your eyebrows, when you try to frown, you can't do it. Or the goal usually that I have is that you can do it, but you're not doing it as much because we don't want you to have this kind of stone looking face that's not moving at all. So if you look at the gentleman here on the left side, this is before Botox. He's being asked to smile as big as he can, and he's on the bottom, and to frown as hard as he can on the top. After injecting with Botox, he's gotten quite a bit of Botox on the top. You can tell he's trying to frown and he can't make that expression. By doing that, that's going to get those wrinkles that get etched in from those muscles folding over and over and over again to go away. Similarly, you can see when he smiles, those what we call crow's feet, the lines around the eye, are much less prominent. He's still smiling, but it's not causing these muscles to constrict. So Botox is an injection that you do in office. It's sticking a needle into your face. It's a very small needle. It hurts a little bit, but it's really not too bad. Usually it lasts for about 4 months, and it's something you want to continue doing every 4 months. And the more you do, the more those wrinkles will fade away. So in general, that works well for wrinkles on the upper part of your face. Wrinkles on the lower part of your face, so kind of here, these lines that come around here, these are what we call static wrinkles. They're not coming from movement. They're there at all the time. These are a place where we use what's called a filler, and one that we like to use is called Juvederm. Juvederm takes a compound called hyaluronic acid, which is what your body produces on its own to give kind of fullness to your skin, and we inject more into certain areas. So we'll inject here, here. Sometimes we'll do it up on the cheek to give a little bit of a cheek lift, and that can really help fill these areas. Fillers, again, it's a needle in your face. It hurts a little bit more. It's not that bad, but it's a little bit worse than the Botox. Tends to last for about 8 months. There are some fillers that last a little bit longer. They have not as great of a safety profile, so I tend to like Juvederm because it's the one that tends to have the best safety profile. There are some potential complications with fillers that are rare. There are complications with it being injected into blood vessels that can cause open sores and things like that. So it's something you really want to talk with your dermatologist about and make sure you understand the rare but potential complications that you could have. One of my favorite treatments is what's called broadband light. So you can look at this woman on the left and you see all of those brown spots. That's chronic sun damage. And lots of people have this from years and years of sun damage and not wearing their daily facial sunscreen. Fortunately, we have ways to try and erase some of that. Broadband light, it's not truly a laser. It's an incredibly, incredibly bright light That bright light shines on your skin. It looks like a laser device in that it pulses on your skin, and it gets rid of the reds and the browns that cause this. This is really a reasonable result to expect, this woman on the left going to the right. She probably had 4 or 5 treatments to get this, but this really is one that I often recommend to patients and I really think is worth the bang for the buck. So that's broadband light. The other thing that we sometimes do is something called microneedling. So microneedling, SkinPen is the brand that we use. Microneedling are tiny, tiny microscopic needles that poke very small holes into your skin. I like to tell patients to think of this like aerating a lawn. So by basically kind of pulling out those little holes, we stimulate your body's collagen response, and the collagen response comes and can get rid of, this works nicely for fine lines and wrinkles, and it works really, really well for acne scarring. This is the best thing that we have for chronic acne scarring. Those 4 things are what I recommend the most for cosmetic procedures. There are lots and lots of other things that are out there that can be helpful. These are ones that I find to be reliably effective, safe for the most part, and kind of worth their bang for the buck. I'm happy, of course, to take questions on other cosmetic things that are out there, but these are ones that I would say, if you're looking to, if you have a little bit of money that you want to spend and you want to do something, I would kind of try and figure out what is it that you're looking for. Is it more fine lines and wrinkles? So those are those really tiny lines and wrinkles. Then I would say microneedling. If it's the browns and the reds on your skin, then broadband light. If it's deeper kind of etched in wrinkles here, that would be filler. And if it's wrinkles up here on the top of your face, that would be for Botox. So that gives you kind of a background as to what to look for when you talk with a dermatologist or someone about the types of aesthetic procedures you might be interested in. That's what I have for you today. I appreciate your time listening, and I'm happy to take any questions that people have.
Yes, thank you so much. This has been super, super helpful and very enlightening. I'll be sure to be dousing myself in sunscreen and staying on top of it, especially every single day for the remainder of this summer. We have a couple questions that have came in. So one of our questions is there a difference in skin regimen for people of color? And then is the color of the spot to look for on the skin the same shade for all people?
Okay, good question. So for people with darker skin tone, I still think it's important to use a daily facial sunscreen. You're less likely to get sunburned the more pigment that you have in your skin. But it's still, the UVA rays that come in is still what leads to fine lines and wrinkles and that sun damage over time. So there was a great photo that's published in some of our books of a woman who has very dark skin, an African-American woman, who worked as a secretary, and she worked at the same desk every day for 30 years, and she got sun on one side of her face coming in through her window and not on the other. And the difference in the fine lines and wrinkles on one side versus the other are dramatic. The one thing with those physical sunscreens, even though they're microparticleized, they can still be a little bit white in pigment. So for people with darker skin tone, often they feel that it makes them look a little bit white or ghosty or chalky. So that's where something that has a little pigment in it, like that Elta 41 product I was talking about, it has a little brown pigment in it. That's a great daily facial sunscreen. Other than that, that's the only difference I would say. Still, nightly retinoid, moisturizer, gentle cleanser, those are the same no matter what the pigment level of the skin. People with darker skin tend to make darker moles in general. So it's still, darker colors are still something that we can be concerned about, but that's really where I tell people to look for an ugly duckling. So if you have a lot of really dark moles, it's hard to say, well, all of my moles are really dark. What I want you looking for is a mole that doesn't look like the other ones. The darker your skin type, the less likely you are to develop skin cancer, but we certainly see melanoma, basal cell, squamous cell carcinoma in people of all different sun types or skin types.
Okay, perfect. Thank you. We've got another question. So do you have a recommendation for body washes, and what would you recommend instead of using a loofah?
Yeah, so that's a great question. So for a body wash, if you are acne prone, if you get that kind of body acne, then I would think about using that Panoxyl 4% wash. You can, if you're not, then you really don't need anything very harsh. I would use that Cetaphil Gentle Cleanser, which we talked about as a daily facial sunscreen. That's a great body wash to use. In general, I think people use too much soap in our society. There's this soap strips the natural oils of your skin. So you want to be cleanly, but I think people use too harsh of soaps. And similarly, what I tell people is just use your hands in the shower. I mean, a washcloth should be for, I have face paint on that I need to get off, or I have a temporary tattoo or something like that I need to get off. It's really rare that you should need to use anything other than your hands to clean you. The idea that this exfoliates or things like that is kind of, again, a myth that's created by the cosmetic industry to get you to buy more products.
Got it. Sounds good. Another question was, what do you recommend for melasma?
Yeah, so melasma is a condition we see more often in women than men that causes darkening of the skin. And there are two things that we recommend for this. One is a product that's called hydroquinone, which is usually available only in a prescription, and that's a lightening cream that can go on. That helps. If you have melasma, you have to be absolutely meticulous about using a daily facial sunscreen. And you for sure need one that has good UVA protection. My patients who have melasma, that's where I would recommend one of those Elta products like Elta 41 or Elta 46 as your daily facial sunscreen. Because almost everyone with melasma, doing hydroquinone for a couple months, we can get it lighter. The problem is if you go out in the sun even a couple times and you don't have good sunscreen on, it's going to come back. The other point I'd put out with melasma is sometimes it can be hard to differentiate melasma between melasma and chronic sun damage. So you might want to see a dermatologist to get an evaluation as to which one we're actually dealing with, because that broadband light that I showed, that light technique, works really well for chronic sun damage. So if it's not melasma and it's chronic sun damage, it would respond well to that.
Okay, so then kind of bouncing off of that, is there a difference between products that you either get in a dermatology's office versus getting at Target?
So in general, the ones you're going to get in a dermatologist's office are more expensive. They may not be better than a lot of the products that are available at Target. What you're likely to find is the problem is a lot of the products that are at Target are probably not great for you. They have ingredients in them that don't make any sense to use. So the nice part about getting stuff from a dermatologist's office is you've got a set of products that you know don't have things that are likely to be harmful to your skin in them. However, in general, all of those serums and things like that, what I tell people is if you've got a lot of money and you're already using a daily facial sunscreen and you're already using a retinoid at night, then it's fine to say, hey, I want to spend a little money and see if these help a little bit. But really, the most important things to do are a daily facial sunscreen and a retinoid. And if you follow the product recommendations that I have, you can get those at Target and you don't need to get the more expensive stuff.
Okay, perfect. And so one last question is, at what age would you recommend starting to use a serum or a retinoid?
So a lot of people start using, you don't want to start using a prescription retinoid until you've started to go through puberty. So after puberty, then a lot of people start to use Differin or a retinoid like that to help with acne. And I think sometime in your teenage years is a good idea to add that into a regimen of a daily facial sunscreen. And then I would continue it throughout the rest of your life, ideally. Serums, again, I would say they're of less value than the retinoid. So I would say try and get established a daily facial sunscreen and a retinoid. Serums would be kind of like the icing on the cake. And I would say those would probably be something you'd add on in your 20s or your 30s.
Okay, perfect. Well, thank you so much for all of your time today. This has been, extremely helpful, and I hope to be in your chair soon and taking care of my face too. And then I would like to thank our sponsors again and invite everyone to join us in our next webinar where we will be introducing our exciting new app. So July 28th at 11 o'clock Central Standard Time. Be sure to tune in. Thank you.
Great, thanks a lot.
Concludes today's presentation. On behalf of the presenters and Health Easy, thank you for joining.